Thank you. The gentleman yields. We'll next go to the gentleman from Maryland, Mr. Trone. Mr. Trone, you're recognized.
Thank you, Mr. Chairman. Director Young, thanks for your leadership at OMB. And I have a number of questions, but is there anything you want to finish on the response to my Republican colleague?
I think we've answered. I thank Mr. Bergman for that last interaction, but I think we've answered everything. I don't want to take your time.
We're good to go. I applaud the President's bipartisan unity agenda, put addiction and mental health priorities 1 and 2, so thank you. President Biden has done more for this crisis than every other president combined, everyone. However, we're still losing. We're going to lose 1 million folks to addiction overdoses in this decade. We're going to lose about half as many, 500,000 to suicides. So tell us a little bit about how this budget prioritizes these important issues, 1, and 2, with freezing the budget at 22 numbers, as the extremist Republicans have proposed, lead to more lives lost.
Like, 1, there's not one community, probably not one person we could throw a stone and hit in this room who's not been touched by mental health disease in their family and addiction issues. And this has been a bipartisan effort to make sure we do everything we can. And I want to thank the members for doing that. It is very clear if we cut, this is non-defense discretionary. That is where we do mental health and opioid grants is out of non-defense. So if you cut that will be cut. But this president's budget goes further than we've gone before. We would invest more than $75 billion in a set of key proposals to transform behavioral mental health care in this country to address substance abuse and opioids. The budget provides a combined $1.1 billion or 30% more for substance abuse prevention, treatment, and recovery services block grants and state opioid response grants. And I can go on, and I'm happy to provide for the record, but one other thing I want to point out is the $10 billion in mandatory funding for substance abuse SAMHSA, which would be a 40% increase to improve our behavioral health services in this country that are lacking. And also, I want to work with you and others to make sure we have the professionals in that system who have left in droves because it's a tough job during the pandemic to make sure we have the people to staff the behavioral health clinics and services.
Thank you very much. There's no question we're short on staffing, and we've got to provide the dollars to get folks to go into these tough areas in behavioral health and mental health and take these jobs, or America's going to be much worse off, for it. Other area that can help Americans is you have a $2.5 billion for ARPA-H. Success rate at NIH on grants is 18 to 19%. When I talked to Director Collins, he's been crystal clear for the last 4 or 5 years. That should be 33, 35%. That means we're leaving lives, tens of thousands of lives, hundreds of thousands of lives on the sidelines that aren't going to be saved. So what would the idea of cutting the 22 levels do on impacting our medical research and saving American lives?
Look, cut to NIH would take more research grants off the table, meaning we do less in Alzheimer's, cancer, diabetes, any of those research institutes where I started my career as a civil servant, off the table. And the fewer research grants you do, the less innovation you will see in the biomedical research area.
And I am a capitalist through and through, as most of my Democratic colleagues are, capitalists. And to do that, you have to spend money to save money. Spend money to make money in business, spend money to save money. And that's what these votes on ARPA-H are all about, this money, the money for addiction, the money for mental health. It's all about spending dollars to save hundreds of thousands of lives. So we applaud you for that. The last thing I want to quickly touch is in business, you've got to invest in your infrastructure. I was just at a BOP, the CJS hearing on the Appropriations Committee, and the Inspector General talked about the crumbling infrastructure at the Bureau of Prisons. I saw it firsthand last week at FCI Cumberland with the Director Peters when we spent the day in Cumberland at the prison. And we see the same thing at NIST. Our infrastructure is crumbling. The Chinese are beating us. They've copied NIST 5 times over. We don't have the ability, and we have to invest in infrastructure. So this aging construction often gets left behind It's not fun, it's not sexy, members don't ask for it, but we need to invest in construction issues. So any thoughts on that area before I close?
We have $262 million in for construction facilities at NIST. And just to echo what you said, if we want to counter China, we also have to take into account our research space and make sure that we remain leaders in research in this country.
Thank you so much. I yield back.